Hi, I'm Diana Smith, and I'm going to give you an example of a lecture you might have if you were here studying as a student at Southampton. This is a kind of lecture that I might give in Geographies of Wellbeing in Year 2, or a variation on something I would provide perhaps in Environment and Health in Year 3. And this is something directly related to my own research. So as you would have seen from the welcome talk, we are really proud of bringing our research into the classroom to make sure you're learning from the latest techniques and methods that we're using as geographers. So here I'm talking about a very topical issue of food poverty or food insecurity. And this is again linked to some work that I have ongoing across different parts of the country. So I'm going to talk you through an example of the research I've done here and then think about how you might apply this kind of process in your own research for perhaps your undergraduate dissertation. I'm part of the Population Health and Wellbeing Research Group here at the School of Geography. And as you can guess, it looks very much at population studies and also the health and well-being of those populations and how we can improve and reduce inequalities between health outcomes between populations in different areas. So any lecture you have with us will start with a straightforward outline of what you can expect in that lecture. It might also include learning aims and objectives or outcomes that you hope to have as a result of that lecture. And then it will wrap up at the end with the results and then how this will be linked to perhaps a seminar or a follow-up class later in that module. So first of all, I'm going to start off with a little bit of health geography for those of you less familiar with it. So this is my particular area of interest. I'm really keen on understanding the social and spatial differences we see in the health of populations. So what I'd normally ask you to do is look at these maps and think about what they mean to you. So we can see there's a map here of England and Wales in purple, and this is showing life expectancy. So the lowest life expectancy are the darker areas and the highest life expectancy are the lighter colored areas. And we can see there's a pretty clear distinction, isn't there, between what's the north and the south of England, roughly, along the Midlands. And this is called the North-South divide. And it's a well-known phenomenon about the differences between health outcomes between the north and the south of England. And as a health geographer, I'm interested in understanding, first of all, why we see these differences, and secondly, what we might do to address them. After all, it's not great if we have lower life expectancy in some parts of the country. And again, looking at it from a geographic perspective, we're interested in whether the differences we see are down to the people who live there, or whether there's something about the place itself. Maybe there's greater air pollution, which leads to higher rates of asthma and earlier death rates, or maybe it's something to do with access to decent services and to good healthcare in different areas. So we think about all these things and frame it as either contextual effects, which are to do with the area itself, like air pollution, access to services, or compositional effects, something about the populations that are different, that are causing these observed differences in health inequalities, or in health outcomes rather, which is called an inequality. There's also an image here called the Jubilee line of health inequality. Those of you familiar with London and the Jubilee line will recognize this. So in this map, as you go from Westminster down to Canning Town, you lose about 1 life of male life expectancy with each tube stop. And that's from an earlier data set. But the same sort of data still holds true. And in fact, we've seen some recent results from the Marmot Review 10 years on, led by Michael Marmot, that shows real inequalities or differences and unfair differences in health outcomes in small areas across different parts of the country. But what's driving those differences? And that's what health geographers want to understand better. And we can use a range of methods to do this. But I'm going to focus on my particular area of interest, which is food poverty. So I started my career looking at the idea of food deserts, which are areas usually in deprived urban areas where healthy and affordable food doesn't tend to be as easily available. And now I've moved on to look at this consideration of food poverty. So I usually ask the question of what is food poverty and hope that as a class you'd have some answers to this or think about what you think it might mean. Here, food poverty or household food insecurity is referred to explain the inability to access a sufficient diet, like a sufficient quality diet, through socially acceptable means due to financial constraints. In other words, not having enough money to be able to go down to the shop that you want to buy your food from on a regular basis and buy the meal you want for dinner. It can also take into account other factors such as this kind of associated anxiety and mental health distress of not being able to maintain a sufficient diet, so food insecurity. There's a kind of discussion around whether we should call it food poverty or household food insecurity. Food poverty is probably it is a more emotive term, so we automatically think of poverty and not having enough of something and then link that to food. And household food insecurity, for one, doesn't roll off the tongue quite so nicely, but also can be confused with the idea of food security. And generally, as a population, are we able to get enough food? So you'll hear people use each of these terms, and there's an ongoing discussion about which one is best. But I'm going to use food poverty here for most of the purpose, but it is, in this case, drawing on the idea of household level food insecurity, or not being able to access sufficient food through socially acceptable means, which means not having to use resources like emergency food provision, like food banks. So why are we concerned about this? I've brought in some data here from the latest information from Trussell Trust, which is a large franchised food bank organization across the UK. So they are responsible for nearly 2/3 of the food banks in the UK. And what this graph shows is how many individual food parcels are handed out each year. And we can see there's been a sharp increase over the last few years in the number of parcels handed out. Now, of course, this data is not perfect. It's showing the absolute number of boxes of food handed to people. So we don't know how many people might be repeat users, or if these are each individual, how many might be one-off cases. It doesn't really matter, however, because the picture is still the same, which is there's increasing demand for emergency food over time. And what do we know about this? Why are we seeing more people using food banks? And I'll talk a bit more about food banks in a moment, but food banks are the kind of key resource for emergency food provision. When someone does not have any ability to access food on their own, or they're not able to get help from friends or family perhaps, they can turn to a food bank. And a food bank is accessed using a voucher, so there's a system of referral through perhaps a GP or a social worker, Citizens Advice Bureau, or a benefits handler. And what we know from the Trussell Trust Food Bank, which requires this kind of information to be collected when a voucher is handed out, is that the biggest cause of referral to food banks is due to loss or low income. And I imagine we'll see even more of this with the pandemic of COVID-19 and coronavirus, where we've seen 1 million new people sign on to universal credit in the last 24 hours alone. So I imagine we'll see more people turning to food banks as well. At the same time, food banks are now going to be struggling to access food themselves because of the current demand on system. But I digress slightly. Let's think back to food poverty. So the key messages I want you to see from this graph, again from the Trussell Trust, so about 66% of food banks across the UK. Low income and benefit delays and benefit changes are all driving the need for people to go to food banks. Other factors include being homeless, being in debt, holiday hunger or child holiday meals. That's when children are usually getting free school meals during the school year, but then when the schools are shut down, there's no longer that food resource available, which puts more pressure on constrained family finances. What's interesting is to see that a lot of people who access food banks are in work. So we have a lot of what's called in-work poverty. Families and households who are working but still not able to meet their needs through the wages they earn. What I find especially interesting is to consider this next bit of data from Canada, which is that in Canada, which has had a food bank system far longer than the UK, only about 20% of people who would identify themselves as being food insecure, not being able to meet their needs normally, are using food banks. That means 80% of people who are struggling to feed themselves and their families are not accessing this kind of emergency food provision. This is why we can talk about food poverty, which we don't know a lot about in the UK, other than it's growing, and we don't know where people who are in food poverty live. We can't use food banks as an indicator of where food poverty might be, because not everyone who is in food poverty, in fact, not even the majority of people who experience food poverty, are probably using them. So what leads to people being in food poverty? It's a whole range of factors, but what we see, what I hear talking to local stakeholders, because that's a big part of my job in this research, is that a lot of people find themselves what's called shocked into food poverty. So things are okay, they're perhaps just about managing, as Theresa May referred to a few years ago, but something happens which puts them into a situation and they have to decide whether they're going to pay for their housing, for their heating, or for food. And this could be something like a loss of a job, something goes wrong with a car, perhaps a washing machine breaks down and they have to get it replaced. And this can put people into a situation where they have to reprioritize limited finances, and food is the thing that's easiest to cut back on, isn't it? I think we can all reflect on that in our own lives. A lot of people will comment on, oh, sure, Diana, that's fine, but I see that a lot of relatively poor households have things like enormous televisions or the latest mobile phone. Possibly, yes. But I think the thing to consider here, looking at, again, some of the qualitative literature around poverty generally, is that we have to remember that contracts continue. So you might have been in work for quite a long time. Job is lost, as we've seen a huge swathe of the population experiencing now, but your mobile phone contract doesn't end. Anything you bought on credit doesn't simply disappear. You've already invested that much money into the system to access that good, whatever it might be. But food is an easy way to make savings. And it's the thing that people tend to cut back on to the point where they will have very little left in the cupboards. Inflation is another major concern. So inflation has been continuing, but our salaries have not kept up with this. So inflation is going up, cost of housing is increasing, the cost of daily goods are increasing, but most salaries are not increasing in line with inflation. In addition, we have, of course, an insecure working environment for a lot of people. So there's the gig economy, and there's people on 0 hours contracts, and they can't budget appropriately without knowing how much money is going to be coming in. So these are the kind of shocks that can influence food poverty. There's longer term factors like inflation and insecure work and increasing cost of living. Overall, I would say the solution needs to be holistic. It's not just about giving people access to food banks, it's also about improving income and also, of course, making sure that people are able to make the best use of their income and their resources. So a lot of people turn to the idea of using advice and cookbooks and getting people to cook more from scratch, which is great if you have the resources. But if you've ever lived in a bedsit like I have, you know that sometimes you live in a tiny little flat with a fridge with no freezer apart from space for an ice cube tray. So you can forget about batch cooking and freezing everything. So we need to think about the constraints of a lot of families facing food poverty. Not everyone's going to have all the space in the world with the resources to do cooking and this sort of thing. There's also the issue of the poverty premium. And this is something which, again, if you think about it for a moment, it makes complete sense. And this is that people who are in poverty or on lower incomes generally might end up paying over the odds for the same goods that the rest of us can buy in a different way. So, for example, if you've ever had to pay for your energy use on a prepayment meter, you'll know that the cost per unit of energy, of electric and gas, is much higher when you're paying for it using a card going into the wall rather than when you pay it on a monthly direct debit. Renting is another major concern because, of course, the cost of renting can increase quite easily. And previously, of course, when you wanted to rent a property, you had to go through all sorts of background checks and contract arrangement, which would lead to huge fees. I was once really shocked when I signed a contract for a flat when I was living in London, and I paid well over £200 in various fees for the contract arranging, which must have taken 5 minutes based on a template, and then the background check was required for me. Luckily, a lot of these things have been changed recently, but it doesn't change the fact that a lot of folks have very little power over the amount of rent they're able to pay to stay where they want to live. There's also, of course, payday loans, which we have to consider, so a much higher rate of interest on payday loans than you would have if you went to the bank. And then again, looking from a food perspective, sometime go into a little Tesco Metro near where you live and see how the prices compare to a bigger Tesco. The town that I live in has a fairly good-sized Tesco and then a little Tesco Metro around the corner from where I live, which is the poorer end of town. And I went into the bigger Tesco a few weeks ago, and I noticed that the soup that I was buying and some cheese to go along with it were in total about 40p cheaper in the bigger format Tesco in the wealthier part of town versus the Tesco Metro in the poorer part of town. Now 40p will buy you a banana and something else because a banana costs 25p. So you're paying over the odds because you're in a smaller format shop which tend to be located in more disadvantaged areas. So there's a lot of challenges here, aren't there? We're looking at a system which puts people who are on lower incomes at a greater disadvantage, and then they may end up in a situation of food poverty, and they need to have some sort of access to help. So food banks are only one solution. As I mentioned before, you have to have a voucher in order to access a food bank. What I haven't mentioned is that the food banks themselves also limit the times you can use them. So usually it's between 3 to 6 times per year, per 12-month period, you can use a voucher. And those will give you food, typically for a Trussell Trust food bank, 3 days. Some of the independent food banks, like the ones here in Southampton, will give you food for 5 days, so they're a bit more generous. Either way, it's going to be processed food, tinned food, food which has a long shelf life. The other issue is if we're trying to look at food poverty and understand where it's happening, food banks exist where there's capacity, where there's a space to store the food and where there are volunteers to hand out the parcels. The other thing is food banks aren't open like a Tesco 24/7 or longer hours. They tend to be open for a few hours one day a week. In Southampton, we have the Southampton City Mission Food Banks, of which there are 5, and there's one open each working day for about 4 hours. So you have to be able to go to the food bank during the time which they're open, which may not work if you have a job, which again we know a lot of people who are using food banks do. So food banks are a sticking plaster to a bigger problem. So what do we need to know about food poverty? Well, quite a lot actually. So what's interesting is that in Canada and the US, where household food insecurity and food poverty have been a problem for much longer, there are national surveys which collect information about the people who identify themselves as being food insecure. There's lots of different ways to think about how you measure food insecurity, but probably the easiest way is to ask folks, have you ever had to skip a meal? Have you had to cut back on the size of your portions? Have you made the decision to feed your children rather than yourself? These are all questions which go into the food insecurity scale used in the US and Canada. Here in the UK, until recently, there's been no such measure of food insecurity or food poverty. However, more recently, this has been introduced into the national surveys, but the data won't be available for quite some time. And even when it is available, it will give us an overall prevalence, like 8% of the population have low to moderate food insecurity, but it won't tell us where they live, which makes it difficult in terms of thinking how we might address these inequalities and ensure that resources which are needed are sent to the areas where they're most required. So I was enthusiastic about this when I first read in 2008 this Inquiry into Hunger, which was convened to talk about how we would better feed the country. And the first term of reference from this all-party parliamentary group was to identify the spatial extent of food poverty and hunger in the UK. And I thought, this is not too dissimilar to work I've already done, and it sounds like a great job for someone like me who's a geographer with a keen interest in food and social inequality. There's different ways of answering these questions, of course. There's ethnographic research where you go and observe and see how people are working in different spaces and try and gather information from this perspective, which is what Kaylee Garthwaite did from her book, which is called Hunger Pains. She spent 18 months working in a Trussell Trust food bank, or volunteering in a Trussell Trust food bank, and used a mixture of ethnographic research and qualitative research, talking to people about their situation, in order to understand why they ended up in food poverty and what would be the best answer to deal with this situation. One of my colleagues, Claire Thompson, conducts go-along studies when she's doing research around diet and food choice, where she, with permission, follows people around grocery stores and finds out what they're buying and what's driving their decision. And price is usually a very large factor for most of us. Then, of course, there's quantitative analysis, so taking data, secondary data, perhaps so data from surveys, from the census, and analyzing it, and that's what I like to do. So the key thing is when you're thinking about big research problems like this, like not understanding why people are in food poverty and where people who are in food poverty might live, think about the skills you can offer. And then think about how you want to formulate research questions. This is really important if you're thinking about, say, your undergraduate dissertation or a research project for a class. For us, we wanted to have an open definition of food poverty, so it was about self-identification. It wasn't about having an income below a certain level of median or answering questions that were very diet-specific, like how many times last week did you eat meat, which are some measures used in other studies. So we wanted to look at the self-identified populations that were higher risk of food insecurity. And to do that, we were able to draw on previous qualitative data led by Liz Dowler and her colleagues. And again, as we've noted, just because there's a food bank somewhere doesn't mean there's going to be high rates of food poverty. It means there's people that have time, capacity, and space to run a food bank. What we wanted to do was create a new flexible risk score, kind of like the index of deprivation that's used across the UK, across England and Wales, that could be adapted to local pressures, which is a part of an ongoing project I'm working on now. So taking the risk score we have devised and modifying it to fit other concerns around food poverty, like poor transportation, which might be a barrier to people going to work, or poor resources for childcare. It was also we wanted to do something which was very user-friendly, which would make it easy to map, because of course I'm a geographer and I like doing GIS, but also because we know that maps are a really good way to engage people and help them to understand where demand and need might be highest. It's far more interesting than a table, isn't it? So here are the early results from Southampton. Not early results, these are actually fairly new ones. So I won't go into great detail of how I use this, but I drew data from this research which showed that people who are claiming benefits and who are on low incomes and have dependent children, or pensioners who live alone and are on low incomes, are the highest risk of food poverty. So I drew together data to identify these population profiles using the census, the Office for National Statistics, and the Department for Work and Pensions on benefits data to be able to create a composite risk score across, this is Southampton. So the red areas have the highest proportion of households that fit those types of characteristics. So again, low income single adults who live alone, over 65s who live alone, low income households with dependent children. And then the areas with the lines across them are called, those are hatched lines, are showing where there's the highest proportion of households claiming benefits that are means tested, like universal credit, job seekers allowance, and pension credit. So what we can see is there's a really, it actually maps on quite closely to the index of deprivation, but we've modified the score so you can also split it and look at the over 65s only, so the older population, and the working age with children population, because of course there's going to be different types of responses to food poverty in each of those populations. The over 65s may have difficulty accessing stores as well as having financial constraints, and the younger populations may have other challenges in terms of dealing with the low income and also managing a busy family life and keeping children in childcare so they can go to work. So we validated this by looking at an outcome which we knew is associated with food poverty, which is childhood obesity, and found there is a significant relationship, which means the two of them seem to be linked, and that's what we expected when we looked at childhood obesity and the food poverty risk. And what was interesting is when we went up to the next scales, this is middle superoutput areas shown on the map of Southampton, which are roughly the size of wards, and they have populations of about 7,000 people in each one. Southampton in itself is called a local authority district, so it's a local authority organization. And when I looked at the number of food banks from Trussell Trust data, which were available at the time, and compared that to the risk of food poverty, there wasn't any clear statistical relationship. However, it turns out the data I had from Trussell Trust wasn't complete, so it didn't actually show the locations of all the food banks. So that's something worth exploring in more detail. So this was done, and it got quite a bit of attention. So we published it in a paper and shared it around using a piece in the conversation, and had a lot of interest from the Joseph Rowntree Foundation, Age UK, and community shops, as well as lots of different local authority groups, local authority public health teams who are tasked with trying to address food poverty in their populations. And they're taking modified versions of the score and updated versions of the score to think about where resources need to be targeted most carefully in their populations, which is precisely how we wanted it to be used. So right now, I'm working with local authorities all across England to help inform food poverty action plans. So we do the same process and really hone in on known risk factors in their areas. So modify the risk score to incorporate perhaps new types of benefits like personal independence payments and disability rather than disability living allowance. And we created a web-based interface here. So there's a website you can go to and explore the data and download it as well. So it's been really helpful for organizations like charities or local authorities which don't have an in-house GIS team and would like to make some maps to support their information and their data. And also, this is all very locally based, which is important because the original risk score is a generic one based on the population of England. And so right now I've got some funding to look at how to make these scores more specific for different types of populations across Hampshire and Dorset. And that's part of an NIHR Applied Research Collaboration funded project. So that's ongoing work, really interesting with groups like the Citizens Advice Bureau and the food banks in our different areas to find out why people are using food banks, and then thinking beyond that, who isn't using food banks and how can we identify these populations at risk through other means. So this is an overview of how you can help use geography to answer one particular research question around food poverty in England, where are people experiencing it and why. And just to give you an idea that actually the skills that you gain from geography, the spatial analysis, the research skills, the different methods can be applied to help answer real world challenges, which are really important. Mixed methods are the best way to do things. So a mixture of qualitative research, my colleague Claire Thompson uses, we wrote the paper together, and me using data, secondary data are best. GIS is really great for good visualization, for quick engagement. You can look at the map of Southampton and think, oh, I'm really surprised to see there's high risk there, or actually this makes a lot of sense compared to what I know. It's really important, but it's also a big responsibility because as geographers, when we do this kind of work, we also have the potential to really influence policy and to think about where things might be better located. So that's why it's always careful to kind of recheck your data and think carefully about how you present it effectively. So if we were doing this in a classroom, we'd be expecting you to follow up with some sort of seminar usually. So I might ask you to think about these questions ahead of the seminar session, which would be an hour follow-up. And you'd have plenty of time to prepare for it as well. So I might say, okay, in Southampton, who do you think needs food aid? What do you think is available? How can it be accessed? And what are the limits to the current food aid environment? And this would be, you'd have to think about who you would ask to find the information, and then how you would collate it together and bring it together to help answer these questions. And then we'd want to look at the upstream drivers of food poverty. So housing costs are major drivers in Southampton for the working poor population. Unemployment and underemployment, so employment when it's well below your actual skill level. And then, of course, it changes to the benefit system. So the movement onto universal credit has had a negative impact for many households in Southampton. So I'd ask you to be prepared to discuss your findings in small groups. No group presentations or anything, but just about talking to each other and learning where you got your information from and how you've brought it together. And then create a plan for Southampton City Council. You can choose one priority area like holiday hunger, so children who are out of school and having to be fed on limited resources. How you provide food for less mobile populations, so think about our current situation, the over 70s who might be in self-isolation, and also for single adults who are experiencing in-work poverty, what's the best response for them? And I'd like you to think about the holistic challenges around the wider cost in any individual's lives. So how can we offset these other challenges and help address food poverty? So I would always, of course, end every lecture as well with a set of resources for further reading in terms of the work that's informed this and the underlying literature. So thank you very much for your time today. I hope you enjoyed that. And if you have any questions, please get in touch with me. My email address is d.m.smith@salton.ac.uk.